Chest compressions should be started as soon as possible upon recognition of cardiopulmonary arrest. This video will demonstrate how to perform optimal chest compressions during cardiopulmonary resuscitation. First, we will look at patient positioning. It is best to place our patients in lateral recumbency for CPR. However, the one exception would be bulldogs. Their chests are wider than they are deep, sometimes called barrel-chested, meaning that CPR is best performed in dorsal recumbency, just like humans. There are two options for hand positioning. For small dogs and cats, your hands should be positioned directly over the heart, where the aim is to directly compress the heart and propel blood forward into the circulatory system. This is otherwise known as the cardiac pump method. This technique should be used in narrow-chested dogs, also known as keel-chested breeds, such as greyhounds. A one- or two-handed technique with fingers interlocking can be used for this. To use a one-handed technique for the cardiac pump method in small patients, your hand should be wrapped around the sternum directly over the heart to enable direct compression as shown. For medium to large breed dogs, it is incredibly difficult to be able to adequately compress the heart using the chest pump method. Therefore, for these dogs, your hand should be placed over the widest part of the chest wall to rely on changes in intrathoracic pressure to get blood circulating. A two-handed technique with fingers interlocking should be used. You want to ensure that your elbows are locked, arms straight, and shoulders directly over your hands. With each compression, the chest wall should be compressed 1/3 to 1/2 the width. Optimal compression rate has been determined to be between 100 and 120 compressions per minute. Some songs, such as the Bee Gees' "Stayin' Alive" and Queen, "Another One Bites the Dust," may help the compressor achieve this rate. Here is an example of good chest compressions. Remember to not lean on the patient and allow your hands to lift off the patient at the end of each compression. During CPR, the compressor should complete a full 2-minute cycle of compressions before switching compressors. The following are examples of poor chest compression techniques. Here, we have an example of CPR being performed on a patient where the table is too high. This prevents the compressor from being able to fully compress the chest. The compressor is unable to achieve the proper depth and force required. Make sure to lower the table to the correct height or move the patient to the floor to perform compressions in a kneeling position. In this example, the compressor has bent elbows. By having bent elbows, this force is decreased at the hinge point in the elbow, decreasing the force delivered to the patient, and will lead to more compression fatigue for the compressor. Remember to have straight, locked elbows while performing CPR. Here, the compressor is performing CPR with the sternum nearest to the compressor. The patient is sliding away from the compressor. Having the patient's back closest to the compressor will prevent the patient from sliding away during CPR. In summary, CPR should be performed at the correct height with shoulders directly over the hands, elbows locked, and straight arms. Compressions should be delivered at a rate of 100 to 120 beats per minute, and considerations should be made for the type and size of each patient.